So ARCHES was a positive study. It met its primary endpoint. There was a 61% delay in progression or death over time. Importantly, subsets of patients that were pre-specified included men with low volume disease, high volume disease, prior docetaxel or not. All of these men had substantial benefits. For example, low volume patients had a nearly 70% delay in radiographic progression or death. High volume patients who are typically treated with docetaxel, we had about 20% of men who had prior docetaxel, had a further delay in progression or death over time with the integration of enzalutamide over ADT alone. Some of the key secondary endpoints that we met were delaying castration resistance, delaying PSA progression, delaying the time to next anti-neoplastic therapy, which was typically docetaxel or abiraterone. So all of these were clinically meaningfully improved by long differences in time. The quality of life of these patients was very high. I mean, that's one of the surprising things about ARCHES, is that the patient-reported outcomes suggested that most patients were asymptomatic, despite, a high burden of disease. 85% of men had bone metastases, for example, but most men had no symptoms from those bone metastases. And the good news with the enzalutamide regimen is that quality of life was high over time and equivalent to placebo.